This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Quikhale T 18mcg Capsule is a bronchodilator used for managing chronic obstructive pulmonary disease, COPD. It helps ease breathing and improve daily activities. Indications and uses. This medication is indicated for the maintenance management of chronic obstructive pulmonary disease, COPD, assisting patients in alleviating symptoms such as breathlessness and improving their quality of life. It is specifically designed to facilitate easier airflow in the lungs, making it a crucial part of long-term treatment plans for individuals suffering from this chronic condition. How it works. The capsule works by opening the airways, allowing air to flow more freely in and out of the lungs, which helps to mitigate the symptoms associated with COPD. Directions for use. Quikhale T 18mcg Capsule is intended for inhalation use only. It is essential to follow the physician's instructions regarding dosage and duration. Do not swallow the capsule or allow it to come into contact with your eyes, as this may lead to adverse effects such as blurred vision. Always consult your doctor before discontinuing use or if you are unsure about the correct administration method. Possible side effects. Common side effects may include dry mouth, while less common effects can range from dizziness and headache to throat inflammation and irregular heartbeat. If any severe side effects occur, prompt medical attention is advised. Precautions and warnings. Caution is advised for individuals with a history of heart disease, kidney problems, or narrow-angle glaucoma before using this medication. It should not be used in cases of sudden breathing difficulties or by individuals under 18 years of age. Pregnant or breastfeeding women should consult a healthcare provider prior to use. FAQs. 1. Can I use this medication for sudden breathing problems? No, it is not a rescue medication. 2. What if it accidentally gets in my eye? Rinse your eyes immediately with warm water and consult a doctor if symptoms occur. 3. Can I stop using it if my symptoms improve? No, consult your doctor before stopping. 4. How does it work? It opens airways to facilitate easier breathing. 5. Is it safe for children? No, it is not recommended for those under 18 years. Thank you for watching this video. If you have any questions or suggestions, please leave a comment below. We appreciate your engagement.